Welcome to another episode of The Breakdown. Going to apologize in advance to everybody here because today we're talking about not just healthcare, but an area of healthcare that I have a little bit of a dog in the fight of. So I have to do my disclaimer for anybody who's a longtime listener or viewer of the show. You know that I work professionally as a paramedic. We are talking maybe a little bit about the paramedic EMS situation in the province of Alberta today, but we're also going to talk about some other things. But because we're talking about those things, boilerplate disclaimer, um, any views that I share here are the views purely of myself and in no way the views of any organization or employer that I may or may not be affiliated with. And I don't claim to speak for any organization or employer other than the breakdown and myself. And sometimes the folks on the team wish I said probably a little bit less, but that's okay. All of that being said, it's a wild time for healthcare in the province of Alberta. And to get a sense, there's been a lot of conversation about the physicians piece because they're getting screwed. There's been a lot of conversation about the nurses piece because they're also getting screwed. But there's this other huge sector of healthcare that falls underneath the Health Sciences Association of Alberta. Very excited to welcome to the show the president of that organization today, Mr. Mike Parker. Mike, thank you so much for joining us today.
Thanks, Dave, for having me. That disclaimer is interesting because that means you're also a member of HSAA. And
Yep.
let me ask you, have you been to a local unit meeting or convention?
I'm a little busy, Mike.
Yes, you are. Thank you for the invitation, Nate. Thank you for the invitation.
I mean, I would love to, but like the reality is, as much as I put the boilerplate disclaimers up, I also think that it's really, really important. Like, I believe that it's important for me as the host of the show to say, hey, yeah, I totally have a bias here. I think that if I was to take on a formal role with any other organization, that would compromise the show to some degree, and that's absolutely not something that I want to do. I don't know, maybe there's organizations like Western Standard and True North who could potentially follow that lead, but they probably won't. Um,
Yeah.
how's Let's start broad,
Okay.
because Daniel Smith has come out on multiple occasions and said, "Hey, I'd love to do all of these things, but we have all of these contract negotiations going on." Um, is HSAA involved in any contract negotiations right now?
Nate, first I'll say that within our 30,000 members, we've got about 28 collective agreements. And of that, a majority are actually open and live in the bargaining table. Not only the AHS document, which is about 20,000 members, Covenant Health is wide open right now and negotiating. We have groups out of Calgary that are open right now. It's a very busy time, and talking about 80% of the membership, all of them are in active bargaining at the moment. So the answer is yes. We do have a lot of agreements going on, AHS being the one that the government has their fingers the most in at the moment.
Here's the question that I want to ask, and I recognize that your latitude to answer it may be somewhat limited just by nature of the position that you're in. But one of the things that's been, to me at least, made abundantly clear is this government has a wild interpretation of dealing in good faith. The We have a premier who will, on one hand, say, "Oh, these healthcare workers, they're just the greatest thing. Love them so much. Homeopathy sounds like a plan. Let's do that too." So it's a wild time to be in healthcare at the broadest, highest level. Are there any problems with these negotiations, with goalposts being moved, or any of those things, do you think?
I'm going to say 100%, Nate, and that I'm happy to speak on, and I have the liberty for sure here. I think it all started when the NDP released the documents or the hidden documents of the UCP on the breakup of AHS. I think they wanted to just dribs and drabs that from the spring. They didn't want anybody to know about it. And all of a sudden it's front page news, and they've got to deal with First Recovery Alberta. And now in the last week, it's been quite interesting, and we should get into some of how that breakdown is going to impact us as well, because at the end of the day, those on the bargaining table, on the other side of the table, the employer side, have no clue what's happening in the big house at the ledge. And I'd argue that I don't think they do either in the ledge. And so when you have all of these changes coming in, the first question any member impacted involved is, how does this impact me? We get a transition agreement or a transfer agreement, it's got to be called, not a transition, that's going to protect them for now. and that agreement expires next summer. What does that mean for anybody? All of these unknowns are sitting at the bargaining table. The people that are supposed to be negotiating with us, being the employer, don't know anything about all of this stuff. And there's an individual sitting there whose direct report is the Premier's office. And that's hot on the table right now. That person knows exactly what's going on, gives direction to those at the table on the employer's side. So who are we actually bargaining against would be the first question in all of this.
Yeah, I mean, Daniel Smith has been very clear that one of the reasons why she made the restructuring changes, and I want to talk about that a
Yeah.
bit. But Daniel Smith has been very clear from the get-go that one of the reasons why she made these restructuring changes is so that she could reach down and have direct command and control over what happens within healthcare, which is wild because, again, homeopathy. But
A theme of the night.
yeah, well, when somebody hands you a bit that you get to hammer on like
Yeah.
that, I
Yeah.
haven't even gotten to the chemtrails yet. But when she's been very clear that that's the reasons for doing it. So and I think I can only imagine how difficult it must be for the people at the bargaining table who are
Yeah.
trying to say, okay, so it seems like in many ways the plans for the disintegration of the healthcare system, and I stand by that term, are evolving as they go. How
Yeah.
do you negotiate with an employer like Alberta Health Services when, as we've seen with the Recovery Alberta piece, they were like, aha, it's not Alberta Health Services anymore. We're just going to move some chairs around on the Titanic here, but it's a separate employer. And presumably that has some implications on the contract. I'm wondering if you could talk about that whole dynamic for a sec.
I want you to take me into a different world after that. We got to talk about kind of like a scan of bargaining in this province, okay, and on how all of the other pieces are moving around us too. But when you look at that whole haha, we're not part of AHS anymore piece, you're legit about this. It wasn't until this summer that I was talking with members in Red Deer and I spoke the words of what it was going to look like for them. That even I clicked in and went, wait a sec. This isn't like Alberta Health that we've all grown up under for the last 25, whatever the hell it's been, that border to border, our stuff is all one system. And as I spoke to these folks, and they were addictions and mental health, just so you know, that's why we were having this conversation. They were the forefront of all of these changes. And it really clicked into my head that moment when this is like a private company. Now there's like McDonald's and Burger King and Wendy's and whatever else, Subway. They're not the same. They're not even close to the same. But we're going to integrate a fifth component, and we're going to call that the integration model, whatever it's called. We're going to take care of all the bureaucracy of AHS. Yet there's almost 1,000 people working at the ATB Center under Alberta Health now. Interesting how that works out. And what does that do at the table? Like our folks are bringing in the work that work started almost a year ago, Nate, when we did a conference in Calgary where we started gathering all the information from members. We did survey after survey of members saying, what is it that's out there that you need to talk about? All of that work got gathered up, and in March of 2024, so 7 months ago, I guess now, 6, they began the conversations. We've put out 15 notices to members on what has been going on in those bargaining tables, and each one of those notices comes with either 2 or 3 days of bargaining with the employer. So that's 45 or 50 days of trying to discuss with the employer issues that are important to us. Got through a lot of the stuff that we term as non-monetary. Let's call it the boring stuff for the frontline worker who just wants to hear about the money. I got it. But it's all those pieces of language where some of our folks have not been treated fairly, all these other pieces of legal that we need to clarify in our collective agreement in the language portion. And we've managed to do a great job of working through and getting some gains for people. Last week, the committee walks in and says, okay, we're done the non-monetary. Let's start talking. And the response from the employer, as we put out in our media releases, was to say, our opening statement is our statement, 7% over 4. There is no more talking. By noon that day, they closed their books and walked out the door, Nate. Imagine what that feels like at the table. These are our members. This organization is designed purely on democratic rule. Those folks are put into those positions on the bargaining team to represent all of this province. From paramedics, there's 2 of them on the board. We have some social workers. We have some folks in the north, folks in the south. As much of diversity as we can get on that bargaining team to make sure everybody's voice is heard. And that morning, after 40 some days of trying to negotiate, was a complete slap in the face to every member there and every member on the front lines. Absolute garbage behavior.
I want to talk about that 7% over 4 years for a sec, because,
Sure.
and then we'll get to the whole thing of the scan bargaining and all that. And then we have other topics that I want to hit on for sure. But I think it's important to contextualize, one of the things, and this is the fascinating thing to me is how much this seems to align with a lot of the conversation that we have had with other healthcare workers. So we just had a conversation with Dr. Paul Parks, former president of the Alberta Medical Association, and he was very clear as well. The problems that exist in healthcare in Alberta are problems that exist for sure across Canada. Probably the same thing could be said about North America. The solutions to those problems are clear. You have to make people feel valued. You have to pay them appropriately for their time. And it's fascinating to me that if you take a look at some of the offers for healthcare workers in other provinces, whether we're talking about British Columbia, just saw a significant, I think I'm working off the top of my head and open to correction in the DMs. It was about 20% over 3 years. Manitoba has seen some pretty significant increases for healthcare workers as well. Alberta seems to go, well, no. And I'm curious, like, what do you make of that? Because if the government is saying, and in effect, the government is the employer now, directly, more so than it used to be arm's length, not so much now. But if the government is saying to the public on one hand, hey, yeah, we got to get healthcare workers, we got to get people to come to Alberta to do the jobs, and they're not creating a competitive environment, to me, for a conservative government that allegedly, he said, squinting, operates on the principles of a free market. It's supply and demand, and whoever pays the most is going to get the most. So why is it what it seems like the government is saying, okay, whoever pays the most gets the most. What if we just paid the least? Am I reading that wrong?
No, you're not. You're spot on. I'm going to use your words. We got a lot to unpack in that statement, Nate. A lot to unpack. I want a t-shirt on that one. But I want to start with, we got a couple of pieces here. First, your comment on the health human resource crisis that we face today. It is not an Alberta issue. It is not a Western Canadian or a Canadian. Our national union is running a task force that I'm part of. We're part of that conversation. And it is not just Canadian or North American. We sit on the Public Service International, which is a global union voice. And this conversation is in Germany, is in the Philippines, where we are harvesting healthcare workers at an abusive, alarming rate. And so it is a global issue. We don't have the people. We don't have the people going into the schools. We don't have the people staying in the jobs. So retention and recruitment become the primary questions that you need to talk about here. What are we doing to retain our folks on the front lines? Well, we aren't reducing their workload. We are maintaining the workload and reducing staffing models. So 2 people that were in the office yesterday, they are both mental health and addictions folks in the city here. And they had a 5-person unit and are now down to 2, doing the exact same caseload. Let's go to EMS. Let's go to your profession here. We at times are running 50% staffing models in the cities. We're running vacancies all over the rural communities north. We are shipping paramedics on their days off, which is no bloody good for your mental health, up into the North Country to work all your days off up there supplying service. And then right back into Edmonton. Let's talk about psychological injury for a long time here. And so all of those pieces are moving out there. And you're right, supply and demand. Okay. Well, what if I de-skilled the work? What if I took the skill set from advanced care paramedic down to primary care? What if I took the skill set from primary care down to EMR, which is a release that might have just happened a week ago? You want to talk about that later? We can. But you highlighted one other piece on geography. You talked about British Columbia, Manitoba, and Alberta. Let's talk about those 3 pieces. Because a year and a half ago, BC said, we have no doctors. What are we going to do? Well, let's jack them up $100,000 a year and see if we get any to come. And if you look at the border of Alberta and BC in the south, from your area down, there was a whole red zone inside the Kootenay interior of British Columbia, no physicians available. But there's a few docs that might have owned a piece of property out there called a vacation house. And as soon as they turned up the temperature on compensation, that red zone shifted to the Alberta side. Lethbridge can't get doctors. The Crozes Pass, they all start losing doctors. Where are they? They went to their vacation homes, re-registered in British Columbia, and that province managed to get their crisis under control, not fixed, under control. And in Alberta, we continue to add de-skilling. And if I could add, you put a caveat at the start, I'll put one now. In no way do I intend to besmirch anybody that does frontline healthcare anywhere, anytime. But when you go from a doctor's level and to say, well, NPs are close enough, and when you from a doctor's level to say, go to your pharmacist and they can diagnose your UTI they publish now on Shoppers Drug Mart commercials. Well, I sure hope it's not a tumor, because you're not checking that out. And that's the risk that we're facing now as we de-skill. We de-skill in EMS, we de-skill in primary care. This is what it's looking like. And the next level of this is that I don't need highly skilled workers. Anybody can open up the service. And this week, there was a speech that came out by our premier that used the term uberizing in relation to seniors care. I want to make it clear that I don't see it as seniors care, but this is on care of those in need. Okay? So we have a lot of folks in this province who are seniors care in care facilities, but they're not just elderly. They are injured or sick or any other category you want to talk about here. And the thought that I could tap on my phone and get a pericare, get a change in their incontinence pad by just tapping on a phone and finding somebody is what's been like these are her words, not mine. I'm going to Uberize. You just tap on the phone. Anyone want to talk about surge pricing in an economy of supply and demand? Like, these are the nut shows that I keep hearing about that just make no bloody sense to me. How do you just, like, I'm going to take care of my elderly parent and I'm going to click on an app and find someone to come by and make sure they get their pills. Not just anybody, but, doesn't matter if you're healthcare, just show up. That's what it's looking like. And that's the de-skill side of this. And that's nowhere near the question you asked me. So you might want to come back and help me refocus here a little bit.
Yeah. Well, the Uberizing piece is a fascinating piece to begin with, because one of the things with the model of the gig economy, when we talk about Uber, when we talk about like even the food delivery stuff, those systems aren't financially viable. And the model that is utilized when we're talking about those gig economy things is we're going to do this at a loss for a few years, crush out all the competition until there's only one left, until we've managed to scoop up everything else and we have effectively control over the whole thing. And that's when you see prices start to jack right up. So if you destabilize, if you go with that disruptor model at the start of things, yeah, things get really, really cheap. But there's a proven curve that happens and then things get more expensive than they were in the first place, but you have at least the illusion of convenience. But the crux of the question that I was getting at is, again, Danielle Smith seems committed to try to make sure that things can get done not in the best way possible, not in the highest quality way possible, but in the cheapest way possible. You mentioned I'm guessing the medical first responder announcement that Adriana LaGrange made with all the paper. There was just so much paper.
Let me just look. Where is that paper? I want to comment on your what you just said about destabilizing, because we can look at our liquor industry that we sold off, the distribution model of our liquor industry, where it was every small mom and pop could open their own businesses and it'll be great for everybody. We can all make money. Show me the enterprise of Liquor Depot and the empire that they've built in this province now. They've owned 3/4 of the province now. One company, right?
Yeah.
Like that falls right in line with what you were suggesting. And it's absolutely true. And that model of cheaper, faster, whatever, more efficient, that's an MBA mindset of, we just got to find efficiencies in this system. Well, the system was actually pretty damn efficient. Was it perfect? No one will say that. Nobody was going to say our healthcare system was perfect,
No.
but it was integrated model. I mean, I worked back in the day of you try to fight over which side of the road the vehicle crashed on to see which district of ambulances got to pick up the patient for the billing. That's legit stuff back in the 90s, man.
What do you think and again, I want to go back to that compensation piece.
Yeah.
Uh, uh,
Oh, yeah, yeah.
the what's the goal there? Because it seems to me, and I'll be candid. I'm having a lot of conversations with friends and coworkers who work in healthcare, who particularly fall under the HSAA umbrella, uh,
Yeah.
and they're looking at the way things are going. I'm hearing the same thing from nurses and physicians, to be clear as well. And there's a stunning number, more than when Shandy declared war on healthcare. There's a stunning number of people that are like, I'm legitimately looking for a plan B. I'm legitimately looking for an exit strategy right now. If you go with the notion of, and I think you're right, unfortunately, if you go with the notion of we can get lesser skilled workers, um, for a certain percentage, I don't know what the percentage is, but if for a certain percentage of the time, if it's just, grandma needs a help getting, she fell down, she needs a help getting up, she's not injured, she's fine, she just needs a lift assist, then you can have anybody who has a functional back and two knees, they can probably get her up off the ground. But when you get into the more complex things, if you are building an entirely de-skilled workforce, then people will suffer. And is there just not an awareness of that fact, or is there just apathy?
But we managed to meet one time. This premier's been in for a little while now. We've met her one time. And we had a focused conversation on health human resource. And on our side was the vice president, myself. And on their side was our friend Marshall Smith, the chief of staff. And their response was, there's thousands of people coming to this province every year. Those workers are coming in. And we said, yeah. And none of them are healthcare workers. Because the healthcare workers are going to BC where they're being respected. The healthcare workers are going to Manitoba where they're being respected. And Nate, I'm going to tie it into the question real tight now and go, what kind of governments are running those two provinces versus ours and the one next door in Saskatchewan? And I think you start to smell a bit of a trend here. Because in Saskatchewan and in Ontario, well, Ontario's going to do Ralph Bucks apparently. I just caught the wind of that this morning that $200 for you and you and you, and we'll get elected. So this is the kind of garbage that we're facing, and it's happening here in Alberta, and it's happening in Saskatchewan. I mean, there's an election right now, and the mess that's going on there is they talk about it, and they don't talk about workers as far as finding skilled workers in the healthcare system. They just assume that workers are workers and generalize because, I'll be honest, I don't think our premier understands what a healthcare worker truly is. Quite comfortable that the health minister has struggles with it. And I know that her relationship when she was over in education wasn't so hot either with the workers in that system. So let's look at the commonalities here, Ontario, Saskatchewan, and Alberta. We'll leave the Maritimes out of it for now. And the difference between Manitoba that recognizes workers and BC that recognizes the desperation that they were facing because they had a crisis like we have now. And they chose to improve the working conditions and improve the compensation. Those were your two words earlier in this chat. And in this province, they are choosing to offload work onto whoever's left behind right now. They're not hiring more. You start to build models of, in your profession, in Calgary and Edmonton, a small hub center of private contractor doing transfers, which gives infrastructure, which gives payroll, which gives all these other management structure build-ups in the city of Edmonton and Calgary. And if anybody was around in 19 or whatever the hell it was, the stroke of a pen changed my shoulder flash from City of Edmonton to AHS. It was a stroke of a pen. And we're walking a very dangerous path towards that today. And so when you sit at a, let's go back to the bargaining conversation. When you're at a bargaining table where they have no interest in discussing fair wages, compensation, adjustments to keep you market steady, what they proposed here, and we put it out there last week, just so I don't step on the toes of our team because they are leading the conversation on how we communicate, okay? But we put it out there that they picked 20% of our workforce for a wage freeze versus a wage increase. And what I'm saying is they'll give you a lump sum check for the equivalent value, but your pay grid doesn't change. And so when we came over from City of Edmonton and Calgary to AHS, there was a significant group of EMT or PCP members who were frozen for a while as the grids adjusted. Well, they're looking to freeze us now because Wages Ontario West dated 2022 research AHS shows that we were higher by 2 or 3 or 4%. And so their old data, it doesn't take into account what BC's been up to with improving working conditions. Manitoba's been improving. Hell, even Saskatchewan offered up money for you to come. But those aren't on grids. This is the other bugger on it. When I offer you 50 or 100 grand to move to my province, it's not on a grid that's being reported by the employer side saying, oh, look at the data, plus 100 or 50 grand or whatever. That's not part of it. It's like, well, 38.50 is what they're paying in BC, and you're close enough. They want to be the middle of the pack, is what they've stated. Chew on that one. Average is good for healthcare.
I'm curious. You know, one of the things that I'm a big believer in is good faith conversations. And so when I say good faith conversations, what I'm referring to with that is the idea that you can say to someone, hey, this is what I think. And they'll say, hey, this is what I think. And that it's a fixed position. It's not a game of one-upsmanship. It's not a game of I'll say whatever's necessary in the given room that I'm in. If you have a position, you have a position, and that's your position. Doesn't mean your position can't evolve, but if you're in one room at 10 o'clock and then you're in another room at 11 o'clock and you're in another room at 12 o'clock, your position should be the same across all of those rooms on the same topic. And I find
Yep.
myself, and I want to be clear, we try to stay out of the federal politics realm on the show because bandwidth is what it is. But it's wild to me that Daniel Smith and the UCP will say, oh, Justin Trudeau, he's made things so expensive, cost of living so expensive, people are barely getting by. It's all so expensive. And when it comes to them paying their employees a fair living wage under that economic model, regardless of who's responsible for it, their reaction is, we'll go with our first offer and there's no conversation. See ya.
And they're using levers now, Nate, and I want to get into that as we just talk a kind of a scan here. Maybe if I can start into that and you can pull me back out of a rabbit hole that I'll dig myself into here. There's 2 pieces of legislation that the government holds if a work group decides to act their Supreme Court decision rights to strike. Okay? That's done. Supreme Court said nobody's truly essential. Everybody has the right. Sort of. And now, if you go to Fort McMurray last week, a group walked off or moved to walk off the job the day before they imposed a disputes inquiry board or a DIB on a bunch of teachers' aides and janitors in Fort McMurray, shoving them into what's called a like a supercharged bargaining, or not bargaining, supercharged mediation session. Okay. Well, the employer didn't bring any money back to the table. They just locked them into a supercharged 30-day mediation that gave 0 changes to the conversation and froze them out of doing a job action. Strike vote in Edmonton here happened last night, I believe, 2 nights ago. 2 nights ago, I think it closed. 97% of the workers at 3550 are saying enough's enough. Their strike date is coming up. Watch for the DIB to fall there. The next piece they've got is called an PET, or a Public Emergency Tribunal. And for myself in Edmonton, found out the hard way on that one back in the early 2000s when we walked off the job here. I'm not sure if Calgary got the similar or not. Sorry, my apologies for not knowing that one. But we found ourselves in court on a Saturday morning, and then in the judge's house on the Sunday morning, and back on the job Monday. It happened that fast, right? And so the fines that they tout are $100,000 per individual, $1 million on an escalating doubler for organizations, and this is how they threaten it. So interesting stakes ahead as we look at this. And all we're asking for is to be treated equal as workers. When you look at other contracts that are now starting to evolve, this can't swear with you, BS on pattern bargaining. Okay, pattern
You can
bargaining.
swear if you want to. I just try
No,
not.
you're no. You're like a member, and I gotta, come on, I gotta be one up here, bro. But the patterns are starting to lay out. They did a bit of work with the inter I'm going to insult them, student docs. What were they last week? They just signed off on residents. Yeah,
Yeah.
on residents, they got an agreement with residents. Yeah, it's not much, but listen, career pathing on residents is not so bad as they move into a doctor's realm in very short order. So, okay, it's lower than whatever, but it was something. The doc's outstanding now till 25. I caught your episode with Dr. Parks there, and yeah, the frustration's rampant. It's really tough to watch and again, he's only in for a year, right? So did what he could when he was there, and that's what it looks like. Nurses have got something that's worth looking at. It ain't what it it sure as hell ain't what we deserve on the front lines. It is not respect. And we don't see an equity piece or fairness between what just happened at our table last week and what's happening with the nurses' table. Are we going to get there? We're heading into mediation now. It's voluntary, right? 2 different phases of this. And in there is an ESA that's got to be completed. And then we got to talk about strike lines and scheduling and are we ready?
Well, this is the part of the conversation that I'm interested in getting your take
Okay.
on
All right.
because I'll take it to the EMS realm, and
Sure.
this is purely a thought experiment, by the way. This is in
Oh,
no
here we
way
go.
advocating for any kind of strategy or anything like that.
Yeah.
Just spitballing over here. Um, it seems to me that with the approach that this government has taken towards hiring and staffing, there has been a move towards, well, what if we relied more heavily on casual employees? What if we had, we've heard
Okay.
multiple allegations in regards to hiring freezes that exist within Alberta Health Services and within the Recovery Alberta realm, and. And it seems to me that that has created a vulnerability that the provincial government does not seem to have an active awareness of because it's I mean, you were talking about the staffing levels that exist for some healthcare organizations seeing things as low as 50%. There's no, to my knowledge, contractual obligation that says, okay, so we have 100 spots for I don't know, nurse practitioner, not nurse practitioners, LPNs. Let's say LPNs. We have 100 spots for LPNs. Of those 100, we rely on 50 of those spots being filled by casual employees and by people working overtime. It would seem to me that the bargaining position for the provincial government isn't as strong necessarily as it thinks it is, because it would be really easy to just say, okay, but none of our casual workers are going to sign up for shifts on Mondays. And none of our regular workers are going to pick up overtime shifts on Mondays. Best of luck. And I mean, that to me is a clearly just a thought experiment, but that to me illustrates that the Uberification of the healthcare system relies on the idea that nobody's going to get creative and nobody's going to play within the rules that they've established. And, obviously, I don't think that, and I want to be really, really clear here, I don't think that any healthcare worker is uh, wanting to see the system crash or wanting to see patients experience negative outcomes. That's absolutely not what I'm saying here. What I'm saying is the situation within the healthcare system has gotten so dire on a such regular basis that I think many healthcare workers are at a place where the only way they can feel they can improve the system is by taking short-term drastic measures. Does the government have any awareness of that vulnerability? Is that a real vulnerability that could potentially be exploited by somebody if they wanted to?
This creation of a just-in-time workforce or an Uberification of our workforce, or I'll just start hitting the auto dialer and someone's going to pick it up, whether they're casual or full-time overtime, I don't care. It's a tragedy that they've created that. When you look at the workforce of your profession, I'll highlight for you. You're meant to do 4 on and 4 off. There's enough money in your pocket that you can have a respectful life and income, and you retire at age 55 with an 85 factor pension, and you'll go on with your day. But it's not that. It's picking up extra trips, picking up extra shifts, running daily overtime. Every time you walk into the job, you don't know what time you're getting off work. Good luck with childcare for anybody that's trying to deal with that conversation. It's been going on for a long time, and in the before days, we didn't have casuals. We had rovers who were full-time people, and when someone called in sick, you would backfill over there. You didn't have an assigned truck in that case. You just went to wherever the vacancy was that day. But now we've gone to this piece where, come in 2 days a week, that's enough for me. I don't really need to work because my partner makes enough money. Okay, but that's not filling a vacancy on a truck. That's not coming into a hospital and running the X-ray machines for an entire shift. That's not what we're doing here. And they've created this piece, and mostly, and I think it's a self-preservation model to only come in 2 days a week anyway, because the work is so lousy. It's unrespected, and the wages aren't that good anyway. When I can go out and pick up work running truck or driving tractor in this province more than a frontline healthcare provider, I'm not asking for more. I'm just asking for fair. And that's not what we see here. And you asked, does the government notice this vulnerability? If there was a collective movement to say, we will not pick up overtime anywhere, that would be considered a job action outside of bargaining and outside of the rules, and it would immediately impose legal responses and legislative responses from a government, and it would run you so fast to the labor board. It would be very interesting.
Well, this is why I was very clear. It was purely a
Yeah.
exercise, and in no
Yeah.
way advocating for any kind of a strategy that anyone should do every Monday.
Listen, I got to recognize this. People are pissed off. They're frustrated. They've had enough. This was an opportunity for this government who now runs AHS, right? Like AHS doesn't exist anymore. They took the whole thing and smashed it to the ground. There's a bunch of pieces laying around and they're in charge of it. They have no idea what they're doing. I'm just telling you what I see from here. I was laughing because I found the old office of the Premier's Chief of Staff card sitting on my desk. Here, look, I'll put it up right for you. Give him a call. Put his cell phone number in the back. And when you they had a chance here. They had a chance to recover this healthcare system. It could have happened at the bargaining table. We believe in the bargaining structure. Our members are there, ready to talk. They understand the issues. And instead of walking in and saying, you talked earlier about, we've each got a position here, but together we can find a way through this. You step down, we'll figure out the way through this, right? Well, they walked in and said, we gave you our offer. What more do you want? See you at arbitration or mediation. You can't get a deal having a third party impose it, Nate. You get a deal for two people talking to each other. And this government chose the wrong path. They chose to say, we're done. And so it's now time for us to start escalating. We're messaging our members. That letter that came out to our members last week wasn't a very good one. It wasn't positive. It wasn't happy days ahead. It was, they walked out of the room. This week, every member should be getting an opportunity to say, click here and tell the Premier what you think about this. We'll track it and see. You get 10,000 responses, then things are getting hot, and I hope their inbox is on fire. That's what we watch for.
Do you think that works? And I mean, here's the thing that I think is, that I struggle with. I have seen no evidence that the standard approaches of petitioning government work with Danielle Smith's UCP. We saw some movement with Kenny with the UCP when the initial curriculum came out, and there were massive protests with teachers and a bunch of other organizations saying, whoa, this is not okay. I have yet to see an instance of Danielle Smith blink. I mean, some people go, oh, but the Sovereignty Act. Well, the Sovereignty Act, as it was originally introduced, was illegal. Like it would have been challenged immediately, and it had no legal strength. It would have been destroyed. That would have destroyed her whole narrative. She had to adjust it in order to be able to say, look, I passed the Sovereignty Act, everybody. So I don't think that that's an example of Danielle Smith being willing to move off of an initial policy position. What I see is, we take a look at all of the statements that have been coming out over the last week. We have Danielle Smith saying, oh, yeah, no, the electronic tabulators, even though it's going to cost municipalities the better part of $5 million, we're still getting rid of them for no good reason whatsoever. Timmy's scared. We don't want Timmy to be scared. The anti-trans policies, the overwhelming evidence, the scientific community, the medical community, the psychological and psychiatric community have all come out and said these are Amnesty International has called out Alberta, and I wish I didn't have to say this next word again because of those policies, but Danielle Smith refuses to move. So I'm curious, how effective is there? I'll ask the question this way. Is there a need for organizations like HSAA, UNA, all of the other labor organizations? Is there a need for those organizations to start to get more creative in how they are attempting to influence the government, because the standard things just don't work?
I think you're spot on. The standard things would include the email campaigns. Standard things would include a lobby action, and we're doing that as well. The standard things are putting a few thousand people in the front of the legislature to make some noise in the coming weeks. These are all things that we can do. Here's a non-standard that actually worked on her, Dinah Life. I'm going to take you back in time to her action. First, she devalued the work that they do by calling them out as not healthcare. So her statement. And then they made some other moves to say, we're just going to move it over here. No big deal, to a private company. And you'll lose your pension and your wages will be adjusted. And we fought back and we won at the labor board, and it wiped out the company. Dinah Life doesn't exist anymore. The corporate parent doesn't exist, and the pension body that owned it in Ontario sold off all assets. Gone. And it was money. It was money. The business couldn't turn a profit off the backs of workers, and so they said, screw it, we're out of here, right? That was the one of the largest wins in my time in this position, was to save the pensions of thousands of people and get them a few, well, I think it was about 1,200 more that managed to get into the plan for securing retirement. Massive. How else do you shake this person? I got to ask you, I mean, you can see it out there. They're going to bus a bunch of students in for a vote. They're going to deny people access because you're not quite blue enough, I guess, Nate? Huh?
That's what I
Like,
hear.
there's some, yeah, there's some weird stuff out there. Never mind. Well, you started going down a path. I was waiting for you to say chemtrails, but it's cloudy here in Edmonton, so I can't do that today, But there's
Those are
some
just
weird
really,
stuff.
really big chemtrails, is what those are. They're just really,
It's
really big ones.
the fog machine's going today. Okay. But there's some really big stuff going on that just doesn't make any bloody sense. And you don't find it in true political leaders anywhere except here. And it's really tough to watch this going on because, in an interview recently, they said, hey, Mike, on addictions, we've got death rates are reduced down to 700 from what it was before. And I was somehow supposed to say that's great, that 700 people last month died from opioid overdose is better than it was. So it's better. Well, yeah. Like these are the kinds of propaganda they're trying to support about all of their concepts, whether it's the sheriffs that are going to now be out there doing police work or whatever that is. Yeah, well, I don't know to tell you about that, or any other wackadoodle thing that she comes up with. It's just bizarre. It's not leadership. It's ideological, and it's insanity at times. Like, we can't keep up with the ridiculousness that comes out of there, and her great new idea on how to, well, you were poking at it at the start of the show, you are using the heat gun to detect your illness kind of thing. I can't wait I forget, I lost the wording on that one, but you know what I mean.
Thermography. Well,
Thermography, there we
if
go.
I was
And
to
in
say
all of
it,
that to say, we're at the bargaining table trying to get a deal. a deal that respects the workers. Yeah, there are workers who are not in the right pay grid. Been talking about it for 10 years at that bargaining table. You know what I'm talking about. And the answer is no appetite for discussion, right? And we've got a bunch of folks that are in that similar circumstance. They won't look at because BC is doing way more. Manitoba's doing more. Where is the answer today? Getting our members to step up a little bit and say, hey, I'm not very happy. I'll click send. What I need from them, Nate, is to recognize where the problem is. Because I can stand on the rooftop of this building all day long with a megaphone and scream my fool head off. Won't change a damn thing. Tens of thousands of people demanding from their local MLAs better starts to shift that piece. They can't take that pressure without responding in a way that's going to somehow help. So when we do this stuff, when we rally at the ledge or do the email campaign, we try to expand it to call upon civil society to step up with us. And we dig into people like Chris at Friends of Medicare or Public Interest Alberta. And these are other agencies out there that look to protect public services that are not tied to workers and unions. They just want better for people. And that's where we build our allyship and say, hey, we need some help here.
Well, you set me up for the plug, because I believe, I could be mistaken, but I believe that the HSAA folks are having a little bit of a get together, and the way that you phrased it, I want to explore a little bit because,
Okay.
what's the date of it again? The thing at the ledge?
Yeah, 28, 24, 24,
I think
right?
it's the 24th. So 24.
Thursday, next Thursday.
What time?
11:30 to 12:30. Real short amount of time there, just at your lunchtime.
And I want to be clear on this because I think it's important to highlight this is not just for HSAA members and the other affiliated unions.
No.
Anybody who cares about healthcare in the province of Alberta. And when I'm talking about healthcare, I'm talking about big healthcare because, again, I do want to pivot back to the Recovery Alberta piece because that is, to me, a case study and let's implement something badly.
Yeah.
But that rally on the 24th is something that anybody who cares about healthcare and who can get to Edmonton
Yeah.
can attend. And I'm sure that there will be stickers or something. Will there be
I'm
stickers?
hoping so. I'm
Okay.
hoping we can find some stickers. I got a few cases of them sitting downstairs somewhere. Nate, this rally is about respecting the front lines of healthcare, and but it's bigger than that because our friends at the ATA are rallying to come join us, and NASA, which is a non-academic staff out of the U of A, are looking to join us, and we're talking about CUPEs, hundreds and hundreds of workers. There might also be a convention for the nurses that day downtown. There might also be a convention for the AUPE that day downtown. So there's going to be a couple thousand people there already. And so I sure as hell don't want to be drowned out by them. And I hope there's a few blue jackets. My flag's ready to go. I just need the time to go do it. And Nate, it's going to be a tough one. It really is because everybody walking in there, and I get it, it's a work day for most, but we're also shift workers, this organization. And if you're not having space in your life to come to this rally, if you can't make it all the way up to Edmonton, there are plenty of MLAs sitting in their offices right now in your jurisdictions. Find a few friends and go knock on the door and talk to them. Like, this is our opportunity. You want to raise the temperature and raise the voices of your working class? This is it. And this rally is going to be a kickoff. I mean, the nurses are looking to do a vote on their TA. We're in a bit of a pickle here at bargaining, and we're looking to get some help from our members to step up and recognize that we're in it now. But civil society knows it. When they line up to get in to see their doc, when they got to wait 6 months, I got a neighbor down the street. She's a cancer care patient now. And just getting access for issues as they develop, as she moves through this chapter in her life, it's hard to watch because I know the inside of the system. And I know why. It's brutal. And it harms people. And within healthcare, this is a difficult question to have. If I asked you to go out and do a job action, well, it might cause a delay for somebody that needs something. And nobody in this organization got into this job to cause harm to anybody. And it absolute diametrically opposes in their conversations because they also want a bloody raise. They want to have groceries on the table and pay the friggin' mortgage, right? But we've also got this piece in us, built in. I swear to God, there's another organ in a healthcare worker somewhere. Haven't found it yet. That makes them just that much more special.
I mean, I go with these are conversations that obviously happen, and the metaphor that I always like to go with for people is if you're in a plane and the plane decompresses. Um, if you're somebody who has the wherewithal to go, oh, everybody needs to put their oxygen masks on, and there's some people who are struggling to put their oxygen masks on because maybe whole list of possible reasons their arms don't work. Let's just go with that because I'm lazy. But let's say that there's four people around you whose arms don't work and they can't put their masks on themselves. You can try to put the masks on everybody else. You'll be unconscious before you get more than one on. And then the other three people are screwed. And sometimes the only way to make sure that you're in a position where you're going to be able to help those people is by putting the mask on yourself first. And this is where I think you're absolutely right. It is incredibly counterintuitive for healthcare workers who have gotten into the field because they want to help people to go, I have to put myself first on this. It's incredibly difficult to do, but the reality is we are seeing record high burnout with it across the healthcare system. We're seeing a net migration of people out of the professions, and if we don't address these underlying issues as to why those things are happening, all of the good intentions in the world without action aren't going to resolve any of these issues. Which brings me to my next question. Have you thought about like HSAA getting like a I hear the hockey games are back in you guys could get like one of the boxes that has like the crackers and cheese and stuff. Have you thought about that?
Gonna go just hang out there and invite a few friends?
Well, friends, ministers, MLAs, you got options.
Oh, I gotcha. I gotcha. To see if I can get those expenses approved. I don't think they would be, but I'll maybe I'll call. Hey, maybe I'll call up my friend Marshall.
I want to change gears for a quick
Yeah,
set.
okay. I think we need to.
Gonna get ourselves into trouble here. Uh,
Yeah.
but I want to talk about the Recovery Alberta piece because
Okay.
this is another area. Yes, we've seen the UCP say, look, we've had all of these decreased drug deaths. Well, they're commensurate with what's happening around the rest of North America. And also, we just recently saw news come out in the last couple of days that's like, well, you're 25% off of your numbers in some cases. So maybe don't take such a big victory lap.
Yeah.
But one of the things that I found fascinating was the the execution of the organization. So we're going to make an organization. It's going to be all about recovery, not about treatment, not about mental health. It's recovery. It's going to be about recovery. We're going to name it recovery. That's how serious and committed we are to recovery. And we have received no shortage of messages from people who are working within Recovery Alberta who have said, yeah, so when we call people now to follow up or do appointments, we're
Yeah.
not allowed to say recovery anymore because it turns it into a privacy issue. Because if you say to someone, hey, this is Timmy with Recovery
Right.
Alberta, I'd like to follow up on our conversation. Anybody who hears that immediately goes, wait, what? What are
Mm-hmm.
you recovering from, Timmy? Tell me more. If somebody gets
That's right.
mail from Recovery Alberta, everybody else in the householder in the mailbox gets to see that this is a thing that's going on. And it to me is an example of aspirational thinking that doesn't undergo any kind of r- real beta testing, and it causes demonstrable harm. Um, what are you, because like I know that there's a lot of people under the HSAA umbrella who are in the Recovery Alberta realm. What are you hearing that you can speak to about how that fascinating transition is going?
Yeah. Well, it's not. But I'm going to start with this because recovery, then they bolted on mental health and they bolted on corrections and called it all one big thing, right? Because corrections is all part of this now, and it's a very chaotic piece. It's you know what I want to start with actually, Nate. I want to tell you how we got so engaged in our campaign to try and correct this because it's not an abstinence only model. It's not a one size fits all model. That doesn't help. You got to meet them where they are. And you know why I know all this stuff? Is because one day about a year ago, one of our members walked up and said, Mike, we've got to do more as a union, and laid out a plan. And I said, okay, that plan needs money. When we go to convention, you bring a resolution that says that you want us to do this. And so she wrote the resolution, brought it to the floor, spoke on it like a champion. Man, I got to tell you, she spoke like a champion. And from that, we built a committee that started putting all of this together to understand. Recovery Alberta hadn't happened yet, right? What we were seeing in that moment was closure of safe consumption, basically a criminalization of anybody out there that, and the talk about locking you up if you have an addiction. And these folks said, we need to get this talked about. February, March, Recovery Alberta comes, and the people I'm sitting with that are trying to do some work to save a few lives in this province have just recognized their entire world got shoved upside down. This piece that you've talked about that you can't even say this anymore on a phone call. Yeah, because saying, hey, it's Alberta Health Services, I'm calling to look for Nate. Like that's pretty benign, right? Not a you can have that conversation. This is absolute bonkers. And yeah, I guess saying, hey, I know that this is the employer of Mike, but I'm looking for Mike. I'm from Recovery Alberta. Like it doesn't work. It's not healthy. But these folks built on this piece and champion the cause, and the campaign that we're running over the summer here. It's now, if you check your social media, I hope you've maybe caught one or two images of it in your doom scrolling that you do. Good. Okay. Thank you. It's out there, and it's changing the message a bit. Marshall is still on the active role of private service delivery models. And again, back to our de-skilling, using unregulated persons part, using persons who are recovery coaches, critical to watch because they are now removing mental health and addictions workers. They are removing psychology workers. They are removing social workers from this conversation and creating hubs that have recovery coaches. And this committee said, hey, we need to go to this Recovery Alberta conference. You might have known they got tossed from that event last year in Calgary. And so we got ourselves in there. Oh, that's how I got my card from Marshall and had a quick chat with him about this is all going to be great. And we just got to work together. And don't worry about Red Deer because your members are doing the work. And then we find out not that long ago that their understanding is that an EMS practitioner and a addictions counselor are going to drive around in a car checking back alleys because that's what it says in their report. Like, I don't know what to tell you. When they called and said, what do you think? I'm like, what do I think? We can't staff an ambulance in this province. How the hell are you going to staff a Honda Civic to go driving around looking for people? Like, this makes no sense. But this is where it's going. And all it's done now is increase the volume of patients coming in. And there's this what is it? Who's that cartoon or whatever, where she's trying to dip chocolates and they keep speeding up the assembly line on her. I forget who that show was, but what they're doing now is speed up the assembly line. Don't worry about documentation. Maybe 45 minutes, not an hour, and let's just get them through the door. She talked to someone that does child psychology. When you see it's a 6 and 8 month referral rates, like they can't get these kids in, right? And that's the mental health portion of this that is now going to be I don't know what, because the addiction side is being monetized like we've never seen it. And now all these other pieces here, well, they're not worth as much. It's kind of like the really expensive surgeries are going to still be at the major public hospitals. And oh, look, for $100 million, you only did 4 transplants, but they did 50,000 hips in the private for-profit company. Like that's great results. This is the kind of crap we're dealing with all the way around.
Yeah. For the record, I'm pretty sure it was I Love Lucy that you were referring to there. But
Yes, thank you. Did you Google that while I was talking?
no, I am a student of classic comedy.
It
Um,
was. So this is so thanks for bringing me back to that. This is what's happening here. When I told you about the two folks that explained to me their working conditions yesterday, where there was a 5-person team that operated in their site. Same caseload down to 2 with no positions being filled. No postings being posted. They're just we're now a 2-person unit, we're not 5. Speeding up the assembly line here, and all they are is a tick a box. See you next week. And that doesn't help the clients, the patients, or the practitioners.
the recovery coaches piece is a piece that I find particularly alarming. And the reason why I find it particularly alarming, and I don't know, maybe there was a recent soon to be not chief of staff to the premier of Alberta that serves as a particularly apt case study in this, but um, the uh, the reality is when you're talking about addictions and mental health treatment, when you're talking about uh, recovery from addictions, or I would prefer the term management of addictions because I come from a clinical background, but do with what you will. You are talking about organic processes. These are actual disease processes. Whether or not they're diseases of the mind, of the body, or of both, doesn't change the fact that these are diagnosable and treatable conditions. And when you have people who approach perhaps with the best of intentions. I don't want to say otherwise. But when you have people who approach the management of mental health and addictions with, well, I have this lived experience, therefore my way is the right way. And I understand, I do the drive to go for a abstinence only approach. And I've spoken with many people who are in recovery who say, for me, it had to be abstinence. But one of the other things that most of those people immediately follow up with is, but that's for me. And when we have people who believe in only one approach, who don't have any sort of clinical background. They're not approaching the treatment of these things from an evidence-based foundation. That to me sets a lot of people up for really catastrophic failure. And we see this is where I get really scared, quite frankly, and a little bit angry because we see that the government is making decisions not based on evidence, but rather based on what will be most politically expedient in the moment. And the fact that the government is willing to take the policies that they're doing with the anti-trans stuff, but also say in the mental health and addictions realm, but trust us on this one, we're doing it right here. We're going to take an evidence-based approach. I'm sorry, but if you're going to discard an evidence-based approach when it's politically expedient, I have real questions about your political character. And I have real questions about the fact that you're willing to inflict harm on other people because it's politically expedient for you in the moment. And when we're talking about these recovery coaches, I have no doubts that we are talking about well-intentioned people for the most part. There may or may not be some profiteering. I don't know. But I have no doubts that we're talking about well-intentioned people. But if those well-intentioned people, like, here's what I want to say and what I want to get your response on. There was a period of time where if you had um, any number of ailments, the best approach was, you have a pneumonia, I've got the fix for that, leeches and branding. And somewhere along and I have no doubts that the people who were applying the leeches and the branding were coming from like, I want to help this person. I believe this is going to work. But they were applying leeches to people in bad ways because there are like rare good ways.
I
I
was going to
always
say
have to
there is
qualify
some
that.
study on leeches,
Yeah.
like
But branding is not a thing.
no.
And I worry that the approach that is being used in mental health and addictions and with Recovery Alberta is not that far away from I feel really strongly about branding. So I'm going to be a recovery coach who metaphorically advocates for branding. What are you hearing from your members on that?
So the first kind of awakening of the coaches came at that conference last year when a group of people was offering these training sessions. And so we went to this piece. We wanted to learn. I was sitting with the experts in the field that work on the front lines, and they took me to help me learn what was going on. And so we sat there and they talked about, yeah, so you can take our course and it's 2 weekends and you're going to be a recovery coach. And then if you want to do some advanced training like suicide prevention, that's a class you can take. Like, how long is the class? I raised my hand and like, well, that's 3 hours. I'm like, oh, okay. And then if you want to do a diversity, inclusion, equity course, you can do that. I'm like, well, I just did a university course on that. I know how long how long does this one take? Oh no, that's a 3 hour course too. Okay, so you're doing aliquots of 3 hour courses on some of the most critical portions of understanding to engage with someone who is fragile. That's what you're doing here. They've added the forced recovery, Nate. You got to add that into the narrative here of what they're going to do to forced treatment, and understand that it's not an evidence-based. Is abstinence a strategy? Sure, it is. It's one you can lay on the table. But you're not going to give a whole lot of abstinence therapy to someone who's dead. So why don't we focus on a lot of that too? And so we're going to offer the wraparounds. And these are all from the front lines. These aren't mine. These aren't any miracle thing. This is what should be happening out there. There's no housing. Poverty is an issue in this country. On and on and on about what it looks like. And where people are at is where you've got to get the connection. So instead, we're going to take someone, we're going to throw them in jail. For how long? Under what auspice? Like, we're just going to start tossing them into recovery centers. Who's going to hold them there? What kind of security will be there? Are they in a locked unit? We don't know any of this stuff. And when do we decide to let them out? Because from the folks that tell me how it works out there, when people leave against the recommendation, this is not leaving against the medical order. This is like, I'm in recovery, it's a voluntary thing, and I've had enough and I'm leaving. Okay, can't stop them. That night they get access. They've gone through a bit of a tolerance drop, and they're not back again tomorrow because they're not back again. And our folks watch it in the mid-level communities across this province, in the small communities across this province. These are friends and neighbors out there that aren't coming home tomorrow because they've been in this way. I'm sorry to get, Nate, this is garbage is what's going on here. And
Yeah.
tell me that 700 people is better than last year? Get stuffed. I got no time for this. We are not doing everything we can. How about that? And until you can say to me, there's nothing left to do. And that includes getting rid of these toxic supplies, introducing some form of safe supply, introducing a form of safe consumption, wraparound service, end the poverty and homeless issue, or at least start paying attention to it.
To me, it's fascinating because the way that I make sense of it in my head, uh, and it's a simple metaphor because I'm fairly simple, but you can say a word like addiction, and it's a big word that carries a lot of emotional weight. Um, and you can say the only solution is this one treatment modality, and that's recovery. The problem that I have is I have another word, and that word is cancer. And it's a big word, a lot of different emotions that are tied to it. But
Jesus,
when
yeah.
you say cancer, you're talking about a broad term for a disease that manifests in a bajillion different ways. And we're willing to acknowledge that with cancer because I don't think that anybody would say, hey, if you've got lung cancer, you should treat that in exactly the same way that you would treat brain cancer or skin cancer or. Each of those different subsets requires a different approach. The same due should be given to me to addictions because you have people who come into addictions because they were overprescribed medications. Sure. You have people who come into addiction because they have physical trauma, psychological trauma, sexual trauma. The list goes on and on and on. And you cannot use one modality to approach all of those different causes. And it's fascinating to me in the most tragic of ways that this is a concept that rather than lead the conversation on, which would I think, he said cautiously, move the conversation forward in important and meaningful ways, rather than do that, rather than acknowledge that we're talking about a big word that means a lot of things. The government has taken the approach of we're talking about a big word, but it only means one thing, and that's all you need to know. And the yes, I mean, I feel you 110% there. 700 might be a decrease, but if somebody said to you, hey, you know what? I'm going to burn 90% of your body tomorrow. And then 3 weeks later, they said, great news. Today, it's only 70%. Aren't you excited? I would still go, no, no, I'm not. I'm not happy about this situation at all. And that's the dissonance that I struggle with in this conversation when it comes to these victory laps.
I want to add one more piece to this, Nate. Um, and that's the monetization of the work. Now, you said profiteering earlier. There's private surgicals putting money in their pockets and not responsible at the end of the day when your infection goes up over the weekend. There's organizations now building structures out there, and hey, don't worry, it's publicly funded, privately delivered with a profit margin. And when Bay Street's holding over our surgical suites and shareholders are holding over our addiction centers, there's an accountability there to the shareholder. That's the way the world works. It's called capitalism. If I'm going to invest in a building, I better make my monies back. Where a public system reinvests in itself or finds the most efficient ways within a public system to do it. If you can do it in that system and carve off profits, who's losing? They sure have a goal to keep their beds full, don't they? At any cost. Is my audio working?
Yeah, no, it is.
Did I just talk and you didn't hear me?
No, I got all of that. I was just trying to make sure that I was giving you space to in case there was anything else on the tail end of that. I agree. I mean, to me, that's one of the basic arguments that I think is so simple. The only efficiencies that a private organization, for-profit organization, is going to find are going to be to serve the profit margin. Period. End of sentence. They're not going to be in the best interests of patients. They're not going to be in the best interests of employees. It's going to be the fiduciary duty that they have to the people that want to make money because you can buy things with money. Um, so it's wild to me that anybody approaches hey, what if we had, the private companies do these things? It would be more efficient. I have never understood. There are always going to be efficiencies to be found in any organization. No question. But you do not like that. There's so many mixed metaphors I could use here. You don't solve the problems of an organization by saying, "Hey, there's a more efficient way to do this that will funnel taxpayer dollars away from patient care and into somebody else's Bentley or their skybox seats or." I am so excited for
Did you
the
ever find out what a
2027.
skybox seat cost, by the way? Did you ever find out the cost on that?
Well, here's what I'll say about the cost for the skybox seats. We have not been able to nail down exactly how much those individual tickets were worth. We have been
Okay.
able to establish that the pleb tickets um, that were for sale were well into the range of the $500 to $700 range. So
Okay.
I would only imagine that they are well above and beyond that. But we've got
Just a
a
little bit.
uh we're pulling the trigger on the 27th of our whole deep dive into it's so much worse. It's so much worse than anyone knows. It's so bad. Um,
Okay.
October 24th, 11:30 to 12:30, the legislature in Edmonton, the rally to um unfuck things. Can I say that?
You can say whatever you want. Maybe someday I will too, but at the moment, you wanna unstuck things and get our healthcare workers the bloody respect they need and the pay they deserve. Join us at the legislature. I'll give you 2 minutes of my best words and things, and a whole bunch of other labor leaders are going to also blast it out there. We got to stand up. We got to fight back. And this is what it looks like as a start. And in this moment in time, all of us, whether you're from the union, nurses union, AUP, QP, NASA, teachers, us, 250,000 workers are in bargaining right now and need a deal that respects the work that they do. Come and join that day at rally. I don't know what you're doing that day.
I'm working. I am. I'm working that. I wanted to go, and then I took a look at my schedule. And I was like, of course I'm days. Uh,
That's
but
all
it,
right. That's all
yeah,
right. Well,
I,
listen, all I'm going to say is this. The fact that you know, that's it. As long as people know that there's something not right in this system, that's the first part. There's something wrong here, or people are getting harmed here, and they can't deliver the services that they're trained to do to protect Albertans. So let's fix it.
100%. Anything else you want people to hear, Mr. Parker?
You
I've
know
already
what?
heard you passed your time. So
We have gone a long way. I did touch on our allies out there that always need support. And I want to point your audience in their direction one last time, if I could. Am I allowed to do that here?
100%.
Public Interest Alberta and Friends of Medicare and the Parkland Institute. Research papers, advocating for public health. You want to know why there's a dental care and pharmacare today? Why we've been lobbying federally? Talk to the Friends of Medicare. Public Interest Alberta is going to be some of the premier work that we do on addictions work. They're going to be working side by side with us. They're helping us with a lobby day. They're going to be taking up, well, now they're going to have to take on the seniors care thing that's being dumped off to Nixon. That's going to be a whole bag of, what if he's going to bring his credit card? What do you think, Nate? Is he just fix that hotel room right like that?
It'll
Still
be
don't
fine.
know how the hell that worked, do we? No receipts on that one. But it's going to take an entire province to stand up to protect this healthcare system. And unfortunately, we're going to need to do the same fight for education, for trans rights, for the most vulnerable of this population. And it's not going to come from one voice. It's got to come from everybody. That's what I'll leave you with, that it's not just one person, it's all of us together.
Awesome.
And
Thank you very
thank
much.
you.
Here's the one little thought that I just want to throw
Oh,
in there.
yeah, dude.
Because you were talking about the uberizing of Pericare, and I've been sort of the gerbils have
Was
been
that chewing on you?
spinning
Yeah,
on that.
yeah.
And here's the question that I think people should ask themselves. How much money would you want to go to a stranger's house and clean up poo and put a new diaper on them and then do that over and over and over throughout your day? Like if you're listening to this program right now, put a dollar figure on that.
Mm.
And if you wouldn't do it for 20 bucks an hour to spend your entire day wading through human poo, you probably shouldn't be asking anyone else to be doing it for that dollar figure.
We ask our frontline workers in some circumstances, Nate, to do that today. And that's got to end, right?
Well, I could tell you stories, man.
Okay. Okay.
Mike
That,
Parker.
that might be over and off air unreported, I'm assuming, huh?
Oh yeah, no, for sure. Mike Parker, I want to thank you so much for taking the time to chat today. I wish you the best of luck on October 24th, and I imagine that we will be having you back on the show in the not too distant future, as there are so many loose ends that are unresolved in this conversation.
I look forward to hearing from you, Nate. Call anytime. Thank you, and thanks to all your folks that are online watching us.
Awesome. And that's it for another episode of The Breakdown. As always, if you appreciate the kind of content that we're trying to produce here, we would love nothing more than if you thought about signing up to be one of our Patreon sponsors at www.patreon.com/thebreakdownab, where for just the price of a fancy cup of coffee a month, you can help us continue to produce this kind of content. Whether you're listening to the audio version of the podcast, in which case, maybe leave a review and a rating, or whether you're watching it on one of our streaming platforms, we want to say a big thank you to everybody who is part of the Breakdown's audience. And as always, take care of each other and keep the conversation going.